I had the procedure on Tuesday, the 15th of October. I've got more life daily activities I'm able to do now than I was before. Yeah. My name is Jerry Ross. I'm 78 years old, and I'm a patient of Dr. Margni's. The pain I had before this procedure was terrible. My knee would just pinch all the nerves in it. You couldn't walk. It was just downright excruciating. On a scale of 1 to 10, it was like 15. It was that bad. There's no doubt about it. I was very lucky to find this procedure. Well, it was through my wife. Her and some of her girlfriends had some conversation about this procedure because it was new, because I was contemplating having a knee replacement. And when I found this procedure, I said, well, I'll do this one. If it doesn't work, then I'll get the knee replacement, because I wasn't a big fan of having my knee and my bones cut and a piece of metal in my leg. The pain that I was having, the way it affected my life, was that I couldn't do anything. I couldn't walk. I couldn't get around. I couldn't help my wife half the time, and the stuff that I needed to do around the house, I couldn't get done. Even grocery shopping, she was doing all of it. I'm sitting in the car. I'm driving her, but I couldn't get out and walk around on the concrete floors and stuff. It was terrible. You got a great staff here. That's number one. And I'm not just saying that. I've never been in a doctor's office that treated you better. The lady that took care of me in the recovery room, Katie, is that it? Okay, and all those nurses up there, they're excellent. I cannot say enough for them. I mean, if there's something you wanted, they got it for you. And they were right there, and they were concerned. They were considerate. And a lot of times you don't get that when you go someplace like this. The doctor was excellent. Number one, I came in to see him, and he was patient, took his time, explained to me what was going on and how we were going to do it. And then on the day of surgery, he was right there, of course. He did the surgery. And after the surgery, he followed up. He even bothered to call me at home himself. And you don't get that. I can tell you that, because I've had experience with this surgeries, and Dr. Margni, he's great, and he's concerned. I don't think it's just a patient-doctor relationship. Sometimes I think he actually makes it a little personal, so you feel like the guy really does care about you, and I'm sure he does. I mean, or else he wouldn't be bothering to do what he's doing. After I had this procedure, I'm 100% better. The pain in my knee is actually gone. I still have some soreness around from the surgery, and stiffness, but the pain is gone. It was gone, I'd say, the first day, actually. I got out of the recovery. I was able to stand on it, walk. I'm able to get out and walk around, and I'm still, just like I say, I'm still working out some of the soreness in the leg, which is very little. It's more muscular than it is. There's no pain in my knee. Let's make it that way. Since I've had this surgery, it's been 100% better. I'm able to walk around the house a little bit more. I'm able to go up and down stairs. I went into Walmart the other day with my wife and did a little shopping. And just to get rid of the pain, I don't mind telling you, it means a hell of a lot. I mean, I wasn't sold on this process when I took it. But now, yes, after I've had it and see the results of it, yes, I would recommend it to anybody that was contemplating knee surgery. They should come here first. The thing about this surgery is that I understand that it's treating the vessels in your legs, and it's treating the inflammation there. So it's not like a normal knee replacement thing, and you have a lot of pressure on your knee and everything. And this relieves that pressure. And at least I know from layman's term, that's what it did for me anyway. I've got more life daily activities I'm able to do now than I was before. Yeah, thank you. Thank you for making my life better. Thank you for helping me with the pain in my knee that I don't have anymore. That's what I tell him. And I tell him I appreciate him and his staff, because they, again, the ladies up there, I can't say enough about them. And they were just excellent. And the doctor was too. It was a really good experience. And that's the reason I'm here today, because I'm a pretty structured guy. I would not be telling you this if I didn't mean it. And that's where I'm at with it. And I thank him for doing it.